Our research suggests that there's a critical time to do these interventions during middle age to prevent the progression to Alzheimer's at the age of 65 to 75. Once patients develop this disease, those interventions become less effective.
From the USC Leonard Davis School of Gerontology, this is Lessons in Lifespan Health, a podcast about the science and scientists improving how we live and age. I'm Professor George Shannon, Kevin Shue Chair in Gerontology. On today's episode, how Dr. Hussein Yassine is working to slow cognitive decline in people with the strongest known risk factor for Alzheimer's disease. Dr. Hussein Yassine is a professor of medicine at the Keck School of Medicine at USC. His lab is uncovering links between nutrition, genes, and risk for Alzheimer's disease. He spoke to us about his research on ApoE4, omega-3s, and inflammation in the brain. Dr. Yassine, thanks for joining us today. I'd like to begin with asking you for a basic definition. What is ApoE4, and what is its significance in Alzheimer's disease?
Thank you, George, for this interview. So ApoE is a gene on chromosome 19. It exists in the population in three different forms. The 2 form, not very common. The 3 form, the most common. And the 4 form, which makes about 20% of the population. The 4 form, if you get 1 copy from your parents, your chances of getting Alzheimer's disease increase 2 to 4 times. If you inherit 2 copies, meaning you get 1 copy from mom and 1 copy from dad, your chances of getting Alzheimer's, or the odds ratio, go to 12 times, meaning an ApoE4 E4 homozygote, 50% of those homozygotes by the age of 80 will have Alzheimer's disease.
Well, we've been told that omega-3s are good fats that can improve our health and possibly reduce the risk of developing dementia. Can you tell me about your research in this area?
Yes, so there has been no shortage of observational studies suggesting that either increased consumption of omega-3s or greater levels of omega-3s are associated with lower incidence of dementia, especially Alzheimer's disease. However, randomized clinical trials have largely been negative. So in landmark trials conducted in this country and outside, when you randomly assign people to omega-3s versus placebo, we don't find differences in outcomes. So we came about 7 years ago and proposed a different mechanism to understand what's happening. We first said or proposed that patients with dementia or neurodegeneration have neuronal loss, and that cannot be regenerated after you take a supplement or you eat omega-3s. So that is too late. Then we went and said, giving omega-3s to the general population is not going to work because the majority of people are not going to get dementia. So you've got these 2 pieces of the puzzle. Once you get the disease, it's too late. Who do you give it to? And then we said that let's identify high-risk populations that could benefit. And, we were just talking about ApoE4, and we proposed that perhaps if we give enough doses of omega-3s to ApoE4 carriers, could this be a mechanism to slow down the progression of cognitive decline in this population? So my lab is working to understand whether omega-3s can slow down cognitive decline in people at high risk of Alzheimer's disease based on ApoE4. We have 3 different ways we're doing that. One, we have basic science models where we have ApoE4 targeted replacement mice. We have brain imaging where we image DHA brain uptake. And we do clinical trials where we give people supplementation and look at outcomes.
Speaking of supplementation, how high a dose might it take to slow cognitive decline in ApoE4 carriers?
I don't think we know the answer to that. At this point in time, we do not have high quality evidence to suggest that supplements make a difference. in cognitively normal ApoE4 carriers. To respond to this question, we did a pilot trial between 2016 and 2019, where we randomized approximately 15 people to PHA versus 15 people to placebo and monitored them over 6 months. And we found that you need up to 2 grams per day, which is a generous dose, to detect changes in CSF or brain DHA levels. Now, that pilot trial was not designed to look at cognition, was just testing the dose. At the moment, we're doing a larger trial we call Prevent E4, where we're randomizing 320 individuals, 320, to high doses of omega-3s versus placebo to look at multiple outcomes, including brain DHA levels, cognition, and imaging changes.
Does it make a difference if we get omega-3s through our diet or through a supplement?
Yes, it does. At this point in time, we do not have high-quality evidence to suggest that supplements make a difference. But we know from landmark observational cohorts, for example, the Framingham in the US, the Triple C in France, the Rotterdam in Netherlands, and many others, that people who consume at least 1 serving of fatty fish per week have lower risk of developing Alzheimer's disease. In contrast, trials that have involved omega-3 supplements have not panned out. And as we discussed, omega-3 supplements might be too late to be given to patients with neurodegenerations because they may not reverse neuronal death or neuronal loss. And giving them to the general population may prove to be very difficult because the majority of people do not develop Alzheimer's. So we need more research before we can recommend supplements. In addition, we don't know exactly what kind of supplements we should be providing. The exact dose, the composition, the duration. More research is needed to figure out those questions.
Okay, what role does inflammation, specifically in our brain or spinal cord, play in Alzheimer's disease among ApoE4 carriers, and how are you looking at that?
So inflammation increases the risk of cognitive decline and dementia in the brain. And ApoE4 is associated with greater inflammation in the brain. Our research has looked at that by examining the mechanisms that allow omega-3s and fatty acids to exchange in the brain. Throughout a series of experiments we have been doing over the past 3 years, Xiaowei Wang, a postdoc in my lab, identified that a specific enzyme known as CPLA2, or calcium-dependent phospholipase A2, is increased in ApoE4 mouse models. This finding was later confirmed in a cohort of human brains that differ by ApoE4 genotype. This paper has just been accepted and hopefully will be published soon in Molecular Neurodegeneration. What this paper tells us is that the activation of CPLA2 increases the liberation of arachidonic acid, which is converted inside the cell into inflammatory mediators. Since CPLA2 liberates arachidonic acids from membranes, it drives neuroinflammation. To us, that means that CPLA2 could be a potential target. And if we can block it or reduce its expression, we can offset neuroinflammation. The CPLA2 association with ApoE4 is novel, but it has been shown before that strokes, injuries to the spinal cord or to the brain, such as traumatic brain injury, activate CPLA2 and associate with greater inflammatory signaling response. In this case, we identified a subtle activation of CPLA2 with ApoE4. And chronic, subtle, repetitive activation of CPLA2 over a long time can lead to a powerful inflammatory and oxidative stress response that cascades into disease.
Well, talking about other risk factors for Alzheimer's disease, what are cardiovascular risk factors? What studies are you doing in that area?
So this is a great question too. ApoE4 is known to be a cardiovascular risk factor. ApoE4 carriers have elevated levels of cholesterol in their blood, and they are at increased risk of developing cardiovascular disease. In fact, one way to increase the chances of getting cognitive decline in our trial, we are screening people with not just ApoE4, but other cardiovascular risk factors such as hypertension, obesity, diabetes, and lack of sleep, or poor sleep. So we think that the combination of ApoE4 and cardiovascular risk factors increases the chances of getting Alzheimer's. And we think that those people may benefit from omega-3 supplementation.
Are you finding differences between men and women?
Our studies are small sized. To be able to find differences between men and women, you need to look at large population sizes. We're talking thousands of individuals, and we don't have the power to see that. But others have found that there are sex differences, and there is some evidence to suggest that women have a greater disease risk after menopause than men.
So what can people do to reduce Alzheimer's disease risk?
Well, that's a great question. I think timing is key. I think if you know that you are at increased risk based on family history or ApoE4 genotype, nutritional and lifestyle interventions during middle age will provide you likely the most benefit. So our research and others suggest that between the ages of 45 and 65, those at-risk individuals should be on certain lifestyle modifications, whether it is at least one serving of fatty fish per week, some good exercise regimen. We're not talking about marathon running. Maybe 3 times a week, 15 minutes per day is good enough. Lifestyle mitigation, no smoking, reduced consumption of simple sugars to avoid the complications of diabetes and obesity, intake of green leafy vegetables, which are enriched in polyphenols and antioxidants, good sleep, listening to music, certain forms of meditation, or in some individuals praying. And all of these factors, we know that have positive effect on mitigating or decreasing the chances of getting Alzheimer's. One additional factor that I did not discuss is hypertension or blood pressure control. Blood pressure is known as a silent killer because people have blood pressure, but they don't know that they do. So blood pressure control, diabetes control, cholesterol control in middle age, together with these lifestyle changes, can really pay dividend decades later. Once people start having symptoms, and we're talking now 60 to 80, they often come to us and they're talking to us about omega-3 intake, about all these changes. And unfortunately, at this time, the interventions are not very effective.
Okay, speaking of that, what is nutrigenomics and how might that help us reduce the risk?
Nutrigenomics is the study where you combine nutritional profiles and nutritional interventions with knowledge of gene variants. In our case, we have found in our studies that ApoE4 carriers are oxidizing omega-3s at a greater rate than non-carriers. And that means they have a greater requirement for omega-3s compared to non-carriers because they use that omega-3 to generate ATP. That means if you happen to be an ApoE4 carrier, you may need to take or consume more omega-3s than a non-carrier. So in this case, a general recommendation may not work. The general population may not need an X amount of supplementation, but nutrigenomics allows us to zoom in into a specific population based on specific genetic profiles to define specific needs and therefore address a gap in the treatment and preventions of diseases like Alzheimer's.
Well, that's a lot of information. What's the biggest takeaway that you want people to understand about your research?
The biggest takeaway is that there is a life course risk of Alzheimer's disease in ApoE4 carriers that starts shortly after birth. But mainly, it takes decades. We know from imaging studies between the ages of 20 all the way to 60 that the ApoE4 brain is compensating to maintain cognition. Once this compensation fails, ApoE4 carrier brains starts deteriorating and you see signs of neurodegeneration and Alzheimer's dementia. Our research emphasizes the importance of a healthy lifestyle, which includes sufficient omega-3 consumption, and that's defined as at least one serving of fatty fish per week. Lifestyle factors such as exercise, sleeping, music, meditation, family connections, combating depression and social isolation. And social isolation is a problem now with COVID. And in addition to that, not smoking and reducing the amount of simple sugars consumed to reduce diabetes and cardiometabolic risk. Those interventions, we all know that they are critical, but our research suggests that there's a critical time to do these interventions during middle age to prevent the progression to Alzheimer's at the age of 65 to 75. Once patients develop this disease, those interventions become less effective. So this is the greatest takeaway from the research we are doing.
So I understand what you're saying, particularly with middle-aged individuals. What's your message to young people?
So my message to young people is that if you have a family history of Alzheimer's disease, or that you know that you are an E4 carrier, plan in advance. Learn about the risks of Alzheimer's disease. Learn about the risks of carrying the ApoE4 genotype. And get informed, because we have cutting-edge research to help you out in preventing the risks of this disease early on.
One of the things that I teach in my classes is the life course perspective. And what you're talking about is it suggests that this is a prescription for all of our lives right from the beginning. Maybe that would help delay onset of some of these diseases, including, of course, Alzheimer's. Is there anything else that you'd like to add that we haven't touched on?
I mean, we've covered almost like the major points. ApoE4 carriers, there's evidence that even at 1 year of age, they have certain thinnings in areas of the brain, suggesting that this could be a very subtle congenital disease. So this population is quite important to understand and study. As I mentioned before, up to 25% of individuals carry ApoE4. So in a room of 100 people, 25 people will have one copy of ApoE4. That's enormous. And they make the bulk, up to 50% of patients with Alzheimer's. We have so many ApoE4 carriers in the community, and I think more research in this area is very important to the future of mitigating or changing the risk of Alzheimer's disease. We should start early, and we should try the best we can to prevent this disease, because we know once it happens, it's very difficult to treat.
This has given me a lot of fodder from my classes because, as I said, I'm always preaching, what you do right now. We are the sum of every moment of our lives, and you're young and you think that you've got a lot of time ahead of you. The fact is, I know for a fact that it goes by so quickly, and you have to start preparing now. And I think what you said is clearly makes that point. You cannot put it off.
Yes. And I think what we have learned also that, this disease is so nasty in the sense that the brain has to cope with it for decades. And by the time you start getting symptoms, that means your neuronal cells have died and you developed atrophy. And then this is a big challenge. And it led the whole field to move toward brain imaging in asymptomatic individuals based on genetics and so forth, to understand what is happening 2 decades before the disease starts.
Yeah. Well, thanks so much. It's really been an informative conversation. And I think many people who listen to this podcast will benefit from learning about you and the work that you're doing, the fine work that you're doing.
Thank you. And, if anybody listening to the podcast has family members or with Alzheimer's disease, they are concerned about being an ApoE4 carrier and would require more advice or perhaps participate in any of our trials, please feel free to email me. My email is hyassine@usc.edu. And you can look me up at the USC directory website, and I'm happy to help.
Thank you, Dr. Yassine. And you've really given us a lot of information that I think can really help many people in transforming their lives. That wraps up this lesson in Lifespan Health. Thanks to Hussein Yassine for his time and expertise, and to all of you for choosing to listen. Join us again, and please subscribe to our podcast at lifespanhealth.usc.edu. Lessons in Lifespan Health is supported by the Ney Center for Healthspan Science and Center for Lifespan Health.